Hi, hi. Thank you very much. This is my first episode. Speak in English because we're gonna bring the customer from the around Thailand. Okay. First of all, today my topic is Finasteride. Even though so many questions, so many people ask me a lot about Finasteride. This video will bring you all you need to know before you taking Finasteride. When when to use Finasteride better, but early better or let the hair losing and then we start which area is the best candidate for the crown area, the frontal hairline, and the important thing, find hormone to check before you using finasteride, and how does finasteride is working, what to do if you have experience with the side effect. All this I will tell you. And when you starting using or taking finasteride and your hair still shedding, should we stop or should we continue? Let's begin. Okay. Actually, so many people ask a lot when we choose start. We start if in the this picture, when you have the start losing the hair, should we take finasteride immediately or we wait until a little bit bald and see the skin under the scalp? I think actually the early treatment is the most effective. That means when you start losing, you consult your physician and then you start as soon as possible because will be more effective to stabilize the existing hair. If you let the hair is losing more and then when you take Invisalign, it may be too late. Another thing, how finasteride is affect your hormone. When we take the finasteride, they block the 5-alpha reductase, or DHT will get less. That the effect of the finasteride. This effect will have so many problem with side effect because even though they block the 5-alpha reductase and stop losing the hair, but the testosterone will convert to another enzyme. That's one is called aromatase. That will be increase the estrogen. I will talk why when we increase the estrogen, that means the woman hormone, how affect your body. Okay, you see this picture, not the same. When the different area, the frontal, the mid skull, and the crown, it respond facial totally different. The most the most response is 90% on the crown area. If you want to prevent the losing on the frontal hairline, is 44%, and for the if you losing on mid skull, frontal, and the crown area is response 61%. That means if you thinning hair a little bit on the crown area, the facial line is the most effective. So many male patients worry, uh, I worry about the side effect. 2%, I will lose my libido. I will have the problem with erectile dysfunction. Before you start the using finasteride, we have to take we have to do the blood test for the male hormone, testosterone, and fasting FSLH. This is the my standard because if you get the lower hormone and then you take finasteride, you will get you will have more problem because you will develop to have the malfunction problem. That the standard test we should take your blood test before you taking the finasteride. For the side effect, try to wrap up the four side effect. So many people they don't know when when you take the finasteride is mood swing. This is the common we can find, and 2% you will have the problem with uh, malfunction. And some patient they have the testicular pain, and some patient they have the enlargement, or I can call in the technical term is gynecomastia. This is the common thing. If you have this side effect, you have to consult your doctor. Anyway, please consult your doctor before you taking the finasteride. And if you have the side effect when you consult the doctor, then the doctor may prescribe with a microdose or advise you some suggestion to continue to use or stop using the finasteride because it depends on individual. And the last line, okay, when you take the finasteride, the fact you need to take at least 6 months, you will see the result. Not like a 1 month, 2 month, 3 month. 6 months is 50%. Maximum result from the literature is 1 year. That's the thing when I talk to my patient before he stop taking the Invisalign. When the patient start allow maybe 1 month or 2 months, they will always come to see me. Hey doctor, my hair is still shedding. Okay, please continue if you have no side effect. I hope this show will be beneficial for both of you. Anyway, please follow me on this channel. Thank you so much.